Sienna Bells. Welcome to my channel, Learning Bells Live. Today we are going to talk about clinical anatomy. This is a continuation of our previous discussion on clinical anatomy. So let's begin. First we have prognosis. Number 1, prognosis. Well, diagnosis, we discussed diagnosis. That was identification of the disease. Identification of the disease. Prognosis tells us the outcomes of the disease. Tells outcomes of the disease. Our next term is pyrexia. Number 2, pyrexia. Which is a very fancy term for fever. Now, everyone must have heard of fever. It is a general increase in the body temperature. It can also be a response of immune systems trying to ward off the enemies. That is fever. What is fever? And pyrexia is just a fancy term for this word. Next, we have lesion. Number 3, lesion. A lesion is any circumscribed, that means any specific area, a circumscribed pathologic change in tissue. That is a lesion, a circumscribed pathologic change. This means a specific area of the tissue has gone under some kind of change. That change may be any injury, etc., but many kinds of effects can occur, causing a lesion, a circumscribed pathologic change in tissue. So now you may take a look at the board. Moving on to inflammation. Inflammation, which is a reaction of a tissue, to injury or any kind of abnormal stimulation. Abnormal stimulation like physical agents, chemical agents, or biological agents. Inflammation is characterized by swelling, pain, loss of function. We discussed previously the suffix itis meant inflammation. For example, dermatitis is one very common disease in which there is an inflammation of the skin, in which there is redness, swelling, itching, and pain. Hence, it is always advised to never itch on the area where we get the inflammation or on the skin, that is where we get the dermatitis, so that it does not increase the redness and the spread of the infection. So now you may take a look at the board. Moving on to edema. Edema is an accumulation of fluid. Accumulation of fluid. One very common example is lymphedema. Lymphedema. And from the name itself, it suggests it is a type of edema in which lymph is the fluid which gets accumulated. And what is the word lymph? Lymph is a straw-colored liquid which flows through the lymphatic system. That was about edema. Our next term is thrombosis. Thrombosis, which is intravascular coagulation. Intravascular. The word intravascular means inside a blood vessel. Intravascular coagulation. And the meaning of the word coagulation is solidification of blood. Intravascular coagulation is basically the solidification of blood. Solidification of blood. That is kind of like a blood clot. Next we have embolism. An embolism is basically a flow of this thrombosis, this thrombus. Thrombus is actually the clot, thrombus, flow of a thrombus. Which gets detached from the blood vessel. So this flow of a thrombus can lead to any blockage in any part of the body. Like a very common example is a stroke. A stroke. In a stroke, a thrombus gets stuck in the blood vessels supplying the brain, lacking the flow of oxygen to it, and that part gets necrosed or dies. That part of the brain tissue starts to die. That embolism leads to this death of tissue. So an embolism is basically a flow of a blood clot or a thrombus. Thrombus is a blood clot. So now you may take a look at the board. So I hope you enjoyed this episode, and please like, share, and subscribe my channel, and stay tuned for more videos on clinical anatomy. Thank you.